Good morning. My name is Craig Thompson. I'm the CEO of APLA Health. We're pleased to host Speaker Anthony Rendon, Supervisor Solis, and our other esteemed guests at our newest facility, our Out Here Sexual Health Center at Baldwin Hills. APLA Health's mission is to restore dignity and trust within underserved communities by providing world-class LGBTQ plus empowering healthcare, support services, and HIV specialty care. We have 8 federally qualified health centers locations across Los Angeles County, serving more than 18,000 people annually. I'd like to introduce Speaker Anthony Rendon, who represents the 63rd Assembly District in Southeast Los Angeles County, and invite him to the stage. Supervisor, Speaker Rendon. Get my politicians all confused.
Not a problem. Thank you and good morning. First of all, I want to thank everybody for being here, particularly, obviously, the great organizations who are here today. Also, my longtime friend and mentor, Supervisor Hilda Solis. I also especially want to thank my very longtime friend, Rick Chavez-Zabur, who over a conversation a couple of days ago started talking about monkeypox and the crisis that we're facing that led us all toward being here today. Today we're demanding a stronger action on monkeypox. The good news about monkeypox, is, if there is any at all, is that it is a familiar threat. We have tests and we have vaccines. Sadly, despite 2 years of experience with COVID, our response to monkeypox has been maddeningly slow. Therefore, I have sent a letter to Health and Human Services Secretary Javier Becerra asking him to declare a public emergency on monkeypox. As I said in the letter, we are grateful for the administration's actions to make stockpiled vaccines available. Nevertheless, cases continue to climb, especially in some of California's larger cities. This demands an even stronger response. Had federal officials shown a stronger will to action, more could have been done to stop the spread, just using basic public health methods. During recent Pride Month activities, thousands of those vaccine doses could have been administered at celebratory events, clinics, LGBTQ bars, and gathering places throughout the state. That did not happen, and it enabled this spread. But it's not too late. If we declare a national public health emergency, it will help to ramp up vaccination and testing. It will support state and local efforts for public health outreach and education to support testing and vaccine efforts in California jurisdictions. That should include improved vaccination scheduling to avoid some of the bottlenecks seen in other locations. This is a critical health issue that reflects our need to improve the availability of health care for all Californians. One of the holes we have seen is that Medi-Cal is not reimbursing for monkeypox testing. We must look into that. The monkeypox crisis also magnifies the need to act quickly and appropriately to every apparent public health threat. We should always have a quick response. Had monkeypox primarily affected men identifying as heterosexual, we might have seen that rapid action. When a health crisis primarily affects members of our LGBTQ community, we should also expect a quick response. Whenever it hits and whoever it suffers, it is a California health threat, and there must be action. It's my pleasure to introduce Supervisor Hilda Solis.
Thank you, Speaker Rendon, and also to our colleagues that are here. I am Supervisor Hilda Solis, and I represent the 1st District in Los Angeles County. I'm here to stand in unison alongside my colleagues here today. As you know, yesterday Los Angeles County reported 120 confirmed monkeypox cases in LA County. And I'm here to tell you that while it remains generally low, that number, there have been no hospitalizations or deaths yet. And it is, in my opinion, something that we do have to take note of and take some action on. We have to be be able to take some critical steps to protect the vulnerable communities as outlined by our speaker. During this outbreak, cases have heavily impacted gay and bisexual men as well as transgender residents. But let me be clear, this disease can impact anyone, regardless of sexual orientation or gender identity. And if you need to get tested, please call 211 or visit ph.lacounty.gov/monkeypox. We also have the Janos vaccine, which can prevent the spread. Supplies, as you know, have been limited, and we are hard at work to try to get those doses that we do have administered quickly. Thanks to the Biden administration, Los Angeles County will have a total of 21,000 doses by the end of this week, allowing us to expand that eligibility. If you've been identified by our public health department as a close contact or attended an event with a high risk of exposure, you will be notified. And starting this week, gay and bisexual men and transgender residents with the diagnosis of gonorrhea or syphilis in the last year or are on HIV PrEP medication or attended a commercial sex venue are now eligible. To find a site near you, please visit ph.lacounty.gov/monkeypox, sign up, or call 211. I'm grateful that we've received these additional vaccines, but we're going to need, as you know, much, much more. And that's why I'm joining my colleagues here today to ask for more supplies. And I'm also introducing a motion for next Tuesday's LA County Board of Supervisors meeting to officially request additional doses to meet the needs of those most vulnerable in Los Angeles County. But while we wait for more supplies, we can act now, and we can help to slow the spread of this disease. It's important we communicate directly with our communities, including our Spanish language speaking communities and AAPI residents, as well as our young people, our youth, transitional age youth, as well as our homeless, to make sure that they're getting good information, first of all, about the risks and preventing spread, as well as making sure that vaccines and treatment are available to them. We're also focused on residents experiencing homelessness, working closely with our service providers to ensure that they're receiving the right information and resources. And I've also directed our promotoras, who are health navigators, to be sent out door to door to our communities because they are trusted individuals in our community. We've also seen through the COVID pandemic just how impactful this can be. But if we are all working together, we can make a big difference. We can see that happening. I want to thank everyone for being here and also for supporting this important cause. Before I turn it over to our next speaker, I'd just like to make some brief statement in Spanish. Desde mayo, el Departamento de Salud Pública ha trabajado para reducir el virus de la viruela de mono aquí en el condado de Los Ángeles, mientras también ofrece tratamientos a personas expuestas. Hasta ayer, hoy, un total de 220 casos confirmados en el condado de Los Ángeles, un número que ha duplicado en menos de 2 semanas. Esta enfermedad puede afectar a cualquier persona, independiente de su orientación sexual o identidad de género. Si ha tenido riesgo o ha estado expuesto, crecimiento al ánimo, aquí se haga la prueba, por favor. Puede simplemente llamar al número para seguir información 211. Tenemos pruebas disponibles a través de sitios de salud públicos, privados y laboratorios comerciales. Y tenemos suministro limitado de la vacuna Geneso. Esta es una vacuna de 2 dosis que se puede usar antes y después de la exposición para controlar el virus y reducir los síntomas. Los sumitorios de esta vacuna han sido muy limitados, pero el condado está trabajando para administrar las dosis que recibimos más rápido y más posible. Y mientras esperamos más suministro, cuento que todos que aquí pueden ayudar a las comunidades vulnerables, prevenir más casos de este virus y también hablando es muy importante en los idiomas de los diferentes grupos comunitarios, los latinos, los asiáticos y otras personas que están en riesgos para prevención. Mientras esperamos más vacunas. Y también vamos a mandar una carta, ojalá vamos a pasar un moción que vamos a presentar este martes que llega a la mesa directiva del condado para pedir esta ayuda del presidente y su administración para que mandan más vacunas y pueden tener los recursos aquí para las personas que están impactadas. Con esto me da bastante gusto a introducir. I'm happy to now introduce the next speaker, and that's Craig Thompson. Thank you.
Good morning again. So, as an organization that was founded in 1983 in the midst of the AIDS crisis, we understand more than most, I think, the dire consequences of a failure of a public health response to controlling an epidemic. Oh, okay. Well, we'll just wrap over. So I think today we're calling on all levels of government to use all available resources, and particularly to target the resources at this point towards those that are most affected. And to be clear again, it's gay men, bisexual men, other men who have sex with men, and transgender persons. So we really need to address the resources there first as we begin to roll out our monkeypox vaccine strategy. There's been a lot of conversations about working with public health and the public health response. There's been a lot of communications nationally about various jurisdictions and how they've rolled out the vaccine. Los Angeles County took an equity approach and really wanted to make sure that our vaccine went to those that needed it the most, and also to that there was fair distribution. We support that strategy. We're very pleased that the criteria were opened up yesterday to a broader group of people. And we do need to realize that this equity approach opens us up to criticism of maybe not getting the vaccine on the street as quickly as a first come, first serve basis. But we saw with COVID that if we do first come, first serve around signing up on a website or calling phone numbers, that certain people who have the ability to sit on their computer all day or repeatedly call a phone line will have access to the vaccine before people who really need it. So we support the county's approach of trying to distribute the vaccine in a way that's equitable to everyone. We also call on the county to provide to providers as much information as we can as to when we're getting more vaccine. It's a real challenge for us. We have hundreds of people on a waiting list waiting for vaccine appointments, but we can't schedule appointments until we know how many more doses of vaccine we have coming in and when. So it becomes a problem of communication and capacity. So we call on the county to be as transparent as they can, and as they secure larger doses of vaccine going forward, please let the community know, give us as much notice as possible so we can schedule not only our own patients and clients, but eventually community members to receive those vaccinations. We also need to acknowledge that we are asking our clinics in Los Angeles County and the county clinics to take on this additional responsibility with no additional resources in the middle of a COVID surge and COVID epidemic, and in an era where we have fewer healthcare providers and more vacancies than any of us have seen in our lifetime. So this is going to be a capacity challenge to get all these vaccinations out. So I just need to say that we need to work really hard. We want to work with this. We will work with you. There were mentioned reimbursement issues. That will also come into play as this plays out. We need to make sure that the providers that are doing these vaccinations are fully reimbursed for the cost of the vaccine, for testing, for the patient visit that may go along. Otherwise, we will see providers not willing to be partners in this vaccination effort in the way that they should. In the interim, we invite folks to use our website as an updated sort of information. We try to update it 2 and 3 times a day with not only the official information, but reputable information we're hearing from other community providers. So it's almost like a blog, but that's a good way to get information maybe in between the public health information resources. and it's at aplahealth.org/monkeypox. And we're updating that FAQ and information a couple times a day. So thank you very much. We really appreciate the media's attention to this really important issue and getting the word out. And now I'd like to introduce our colleague and friend of many years, Rick Chavez-Zabur.
Hello, my name is Rick Chavez-Zabur, and I'm the former executive director of Equality California, but here today as an advocate for the LGBTQ plus community. I want to start by thanking Speaker Rendon and Supervisor Solis for once again standing resolutely with the LGBTQ plus community as they have done their entire careers. And of course, so grateful to APLA Health, Equality California, and the National Union of Healthcare Workers, who are such important organizations supporting our communities. I appreciate the significance of California's Assembly Speaker using his voice to call for the urgent action, which is so needed by our community at this time. And this strong call, I'm very, very grateful for, Mr. Speaker. You know, I'm 65 years old, and my own political activism was a direct result of the AIDS epidemic, which began when I was just coming out as a young gay man, while I was in law school. I remember those early days and years when scores of my friends became ill, and the feeling of fear and dehumanization and anger as our federal government stood by and did virtually nothing. While monkeypox is very different from AIDS and HIV, there are some parallels in the initial public health response for monkeypox that are disappointingly similar. Like the beginning of the AIDS epidemic, monkeypox is almost wholly affecting gay and bisexual men and transgender people. And like the early years of HIV, there's widespread fear, a lack of good public information, and growing frustration within the LGBTQ plus community as the public health response lacks the urgency necessary to protect our community. But unlike the early years of both HIV and the COVID epidemics, we have good vaccines that can prevent transmission and reduce symptoms. And unlike the early years of the AIDS epidemic, we have allies like Speaker Rendon and Supervisor Solis who are standing with us calling for urgent action by our federal government to provide the vaccines we need right away. But let me be clear, what the federal government has done so far is not remotely enough. It is not an acceptable public health strategy to have members of the LGBTQ plus community put our lives on hold while we wait for insufficient supplies of vaccines to dribble out. It's vitally important that our federal government engages in an aggressive public health response to monkeypox that sets as a goal to vaccinate all gay and bisexual men, as well as transgender and non-binary people who may be at risk, and healthcare workers who care for us, and to do so with the utmost urgency. Every day that vaccines are widely unavailable relegates gay and bi men and transgender people to living lives of fear and isolation reminiscent of the early periods of both HIV and the COVID epidemics. It prevents LGBTQ plus people from living full lives, and that includes the ability to enter into intimate relationships without fear or health risk, or to even congregate with members of our community and even embrace other human beings. Failure to take action now is not an acceptable strategy. Congressman Adam Schiff, who issued a letter yesterday very similar to Speaker Rendon's, and Speaker Rendon are both very right. The current supply of vaccines on order by the federal government are grossly insufficient, and emergency powers should be used to provide sufficient vaccines right away. And these vaccines need to be provided in the core neighborhoods where the large concentrations of LGBTQ plus people live and congregate. The fact that none of the walk-in vaccination sites in LA County are located anywhere near West Hollywood, Echo Park, Silver Lake, or downtown LA neighborhoods is a glaring problem that needs to be fixed right away, and that contributes to a growing distrust of the public health response to monkeypox. Thank you, Speaker Rendon. Thank you, Supervisor Solis. Thank you for our partners here for raising this important issue, and thank you all for educating the public about the need to do more. Thank you very much. Next, I'd like to introduce Sam Garrett-Pate, who is the Managing Director of Equality California. Thank you.
Thank you, Rick. Thank you, Speaker Rendon, Supervisor Solis, and our partners at APLA Health and NUHW. I want to start by echoing Supervisor Solis in thanking the LA County Department of Public Health for this week, expanding their criteria to include gay and bisexual men and transgender people who are either on PrEP, have had anonymous sex or sex with multiple partners in the last 21 days, or have been diagnosed with early syphilis or gonorrhea within the last year, are now eligible for a vaccination through the LA County Department of Public Health. That is important and we appreciate it. Equality California is proud to stand with all of you today, but the fact remains that none of us should have to be here. We should not have to beg our public health systems, starting with the CDC and FDA, to treat this public health crisis with the urgency and commitment that it demands to keep our community safe. We saw this threat coming months ago. But while the Canadian government and others around the world moved to quickly prepare for an impending outbreak, the fact remains that the CDC and FDA did not. The supply of vaccines from the CDC, as everyone has said, has been too little, too late, and too slow. Unfortunately, our community has been here before. From the AIDS crisis to COVID-19 to the outbreak today, the federal government and our public health infrastructure has been too slow to respond to health crises impacting our community, and it's had devastating consequences. Equality California is proud to stand with Speaker Rendon, who is the first of our allies at the state level to stand up and publicly advocate for an increased response from the federal government, as well as Supervisor Solis, who has led here at the county level in LA, and our partners from LA, from APLA Health, from NUHW, and our former executive director, Rick Chavez-Zabur. We are all calling on the federal government to use every available power, every available resource to meet this moment and end this crisis. And now it is my privilege to turn it over to our longtime friend from the National Union of Healthcare Workers, Sal Roselli.
Good morning. I'm reminded today of the early 80s when our union produced the first literature about AIDS for healthcare workers because the federal government at that time was ignoring the AIDS epidemic. The National Union of Healthcare Workers represents over 16,000 caregivers here in California who devote their lives to caring for their patients, who bravely put their own safety on the line to care for COVID patients, and who are being asked again to put themselves at risk fighting another virus outbreak which is already being mismanaged. The hospital industry failed to protect its workers during the COVID pandemic. Publicly, they lauded their healthcare workers as heroes. But the reality was that the industry failed to provide training, failed to provide adequate PPE and testing, failed to provide hazard pay for workers, putting themselves at risk, and failed to provide sufficient time for those who were forced to quarantine. Now we're faced with another virus, another outbreak, but unfortunately, the hospital industry is no better prepared for monkeypox than it was for COVID. Today's healthcare industry does not prioritize prevention or preparedness. It prioritizes only the bottom line. Healthcare workers need training in how to care for their patients with monkeypox. We need access to federally provided vaccines and testing. We need guaranteed paid time off to quarantine if they get infected. And we need the support of the federal government-funded education campaign to help slow the spread of the virus. Don't call us heroes. Help us protect our patients, ourselves, our families, and our communities. Thank you.
Thank you. Are there any questions? Any questions? It should put LA at an advantage. But the federal government has been, as we've said, incredibly slow in terms of getting the vaccines out here. And that's exactly why we're here, and that's precisely why I sent the letter to Secretary Becerra. That's what all of these groups are here talking about as well. We're calling on the federal government to make sure that we have as many vaccines as possible, and to help us to facilitate distributing those vaccines to people in Los Angeles County. Other questions? Thank you so much. Thank you.